Hi, folks. We're here with Dr. Ryan Canales from the Lawn Trail Veterinary Center in Williston, Vermont. And this man is a bird dog man. He's a great vet, and he knows what we go through. And a big issue, and a lot of you, if you've read my columns in Northwood Sporting Journal, which are all on my website, you know how I feel about Lyme tick disease. It's a brutal disease. You got to look after your dog, especially in the fall. That's when the tick bite is the worst. Ryan, tell me a little bit more about the Lyme disease.
Yeah, Lyme disease is, I remember when I was a kid, if we saw a tick on our dog, it was, my goodness gracious, look I got a tick. You just never, up here in Vermont, where I'm from, we just never saw ticks anywhere in the state. And now to go out hunting or, working your dog to find 25, 30, 40, 50 ticks in certain places is the norm, okay? There are certain places, and I would say state by state, I don't know if it's elevation gains, topography sort of thing. You'll find, like in Vermont, the northern and eastern part of Vermont, will you find them? Not really as prevalent. You go to northern New Hampshire, you don't really run into them. So there are certain areas in the state you can kind of avoid them. But it is very, very, very important, especially with hunting dogs. It's a controversial topic. You'll talk to 100 vets, and this is usually what I tell my clients. You'll talk to 100 vets, and you're going to get 100 answers. And you're going to talk to 100 physicians, you're going to get 100 answers, because nobody really knows the true, we're always finding different things. And I personally go to a lot of talks with Dr. Goldstein, which is out of Cornell University, we were actually at a talk of his down in Boston, Massachusetts, about 2-3 months ago. And it's very interesting because there's a Lyme vaccine, as everybody knows. There's a Lyme vaccine. There's multiple Lyme vaccines out there now, and we recommend, especially here, that you do vaccinate your dogs for Lyme. There are different companies, and I'm not going to talk about the different companies because I don't want to sound biased or anything like that. But we recommend, or I recommend vaccinating, doing a 2-dose series, one now, say for instance, another one in 2 to 3 weeks, and then it's basically once a year. But we recommend with tick prevention, what you really need to key on is the topical as well. Your vaccines are not 100%, and the way the vaccine works isn't like a rabies vaccine or a distemper vaccine that we're all used to getting. Really the way these vaccines work with the ticks is I kind of tell people, and some people don't like the way I explain it, but I kind of tell people you're kind of, and like Dr. Richard Goldstein has told us, you're kind of vaccinating the tick versus the dog. And what we mean by that is that the dog, you vaccinate your dog, and then when the dog gets bitten by a tick or tries to get a blood meal, it ingests the vaccine, basically what you gave to your dog, the immunity that you injected into the dog, and it neutralizes these proteins in the tick, in the gut of the tick. And therefore it prevents the spirochete going into the dog and causing disease. Now, what people don't get is if you just do the vaccine, if you had 50 ticks on your dog, say you didn't use, there's Frontline, there's Revolution, there's Scarborough Collars, there's Certifect, there's a plethora of flea and tick products. If you use nothing and you came out of the woods every day and you had 50, 60 ticks on your dog, is the vaccine going to work? Probably not very well. And the reason we say that is because there's going to be some ticks that aren't going to get part of that neutralizing, in the gut of the tick itself, and it's going to transmit the disease. So we kind of explain to clients the best thing is to use is your vaccine and your tick control, topical tick control. That said, personally, there's 2 products on the market, and again, it could be a little biased, but myself for 30 years of being with working dogs, hunting dogs, we're finding that Vectra and Certifect are probably the two best products out there. Vectra is more of a repellent type of product. It works great for, now these two products, again, they do work for fleas and mice and lice and things like that. But when it comes to the ticks, we have found that the Certifect, which is basically frontline with amitrazine, it's an old drug they used years ago, and with the combination of those two drugs, what happens is it agitates the tick. So you have a much less chance of that tick actually biting the dog and getting a blood meal. I've been using Certifect for almost 2 years, about a year and a half now, and have not had one tick engorged on any of our setters.
Really?
Yeah.
Wow, I find that's incredible news. Because we go through this, I mean, every day at our house.
Now I say this, and I hate to, somebody else could say I use Certifect and we still get ticks, but, there's 7 setters that I'm using it on right now, personally, with myself and a really good friend of mine, and we're just really happy with it. The Vectra, I think, is fairly comparable. The real big difference is that the Certifect, I have had some dogs that have become a little lethargic for a couple of days after they get it applied to their back, and I think it's because it can get systemic, especially if they lick themselves or so forth and so on. So we tend not to sell it as our #1 product. We usually hold it more for the hunting guys that really need to get that 100%, or I shouldn't say 100%, nothing's 100%, but close to the 100% effectiveness. The next product would be your Vectra, which I said again, it does work very well. We really recommend flea and tick control because there is a disease called glomerular nephritis, which is a kidney renal disease that dogs can get. For some reason, we see it more in Labrador retrievers and Goldens. Really haven't seen it in setters, to my knowledge. The dogs that I've been working with, but it's very, I shouldn't say it's rare, but you don't see it very often. But when that happens, and they go into renal failure, that obviously is detrimental.
Terminal.
It is terminal. Yeah. It is terminal. But the other thing that people have to understand, and you will read, you get on the internet and they'll talk about, there's a test called the 4DX test. Okay, it's a SNAP test, and it's a little, all you need is a little bit of blood, and it tests for different tick-borne diseases, anaplasma, Ehrlichia, Lyme, your Lyme disease, and we recommend doing those tests every year. And the reason is because if they get exposed, for instance, if your dog had anaplasmosis and Lyme disease, they're now finding that it increases the chance of clinical signs versus if they had one of the diseases itself. Lyme disease on the SNAP tests are significant of disease. Most dogs, as a lot of people know, don't ever show clinical signs. And that's where the controversy comes into. Do you treat these dogs that are positive with no clinical signs, or do you not treat these dogs? And again, you'll ask 100 vets, you get 100 answers. We tend to treat these dogs for 2 weeks with doxycycline, which there has been some research that actually shows that it has diminished the numbers in the immune system. That said, Lyme disease can evade the immune system, is what we're being told now. So if your dog tests positive, it may test positive for the rest of its life. It may come up negative, though, next year. But they now are saying that they can't say 100% is it gone forever. And some researchers are actually saying you never get rid of it. So we advise our clients, especially the hunting dog guys, to do urine tests on their dog once a year if they've been tested positive. And what that's looking for is protein in the urine, small, we call it microprotein. And if we pick that up, it gives us a little better idea if we're going to run into a renal issue. And if we see anything like that come up in the urine, we investigate a little more to try to prevent those renal failure cases.
Well, that's very helpful, and I really encourage everyone out there to please pay attention to this. It is so important. I have one final question about this. The topical applications and a collar, is that too much? Is that overkill, or will they work against each other? Can you do both a collar and one of the Vectra? Can you do both?
Yeah, Paul, you can, but you really, and again, it's personal opinion from experience, you really don't need to do both. If you're doing Vectra, you shouldn't have to do a collar. Okay. I have my own personal opinions on collar. I never was a fan of collars. There is a collar out there now called Scalabro collar. A lot of guys are saying that they think it does a really good job. I don't have experience when it comes to the hunting dogs. I mean, these are more sort of, house dogs that just go out for a hike with their family. They're not in the woods like our dogs are every day, training. So my experience on the collar, the new Scalabro collar, is pretty minimal. But I'm told some of the hunting guys are using it and having some pretty good luck with it. But you shouldn't have to use both. Okay.
Ryan, thank you so much for your time.
You're welcome, Paul. Thank you.
Bird Dogs Afield, presented by Native Performance Dog Food, providing performance diets for the canine athlete, and brought to you in part by RST, manufacturers of short chamber, low pressure shot shells. Mud River Dog Products, fundamentally changing the expectations of the hunter and dog enthusiast. Pete Shoe Dryer, helping to start every hunting day with more comfort. And On Point Kennel, providing the finest in dog training equipment.